Welcome to the Cyberknife patient information video. This program is intended to help you understand the process of undergoing Cyberknife radiosurgery for head and brain lesions. We believe the more you know about the steps involved in Cyberknife treatment, the more comfortable you will feel throughout the procedure. The Cyberknife system is one of the most advanced stereotactic radiosurgery systems available. It uses image-guided robotics to attack brain tumors and other lesions with multiple beams of extremely accurate radiation. Through its combination of robotics, real-time imaging, and extremely accurate beam delivery, the Cyberknife system represents a major technological advance in radiosurgical treatment.
Well, I think Cyberknife is a significant technological advance over previous radiosurgical treatment platforms, mostly from the standpoint of being able to eliminate the frame and being able to deliver radiation from multiple angles. Those two benefits allow tremendous flexibility for the treating physician to develop a plan, a treatment plan for the patient that has the best chance of obliterating the tumor and the least chance of doing damage to critical structures.
The Cyberknife system does not employ the stereotactic frame used in other radiosurgery systems such as the Gamma knife. The Cyberknife system is thus much more comfortable for patients, with no compromise in accuracy. In fact, published clinical literature indicates that the Cyberknife system's accuracy matches or exceeds that of frame-based radiosurgery systems. Instead of a frame, the Cyberknife system uses bony structures of the skull as a coordinate system to target the radiation to head and brain lesions. These natural reference points, tracked by the image guidance system in real time, provide information on the exact location of the lesion throughout treatment. This enables the Cyberknife system to accurately deliver the radiation, even if you move and the target changes position. The Cyberknife system is used to treat a variety of lesions located in the head, including malignant tumors such as brain metastases, astrocytomas, gliomas, and nasopharyngeal carcinomas. Benign tumors such as acoustic neuromas, meningiomas, and pituitary adenomas. Vascular malformations such as arteriovenous malformations. Functional disorders including trigeminal neuralgia, and other disorders as determined by the medical treatment team. During your initial consultation, your doctor will carefully review your case to determine if Cyberknife radiosurgery is a potential treatment option for you. Cyberknife treatment involves a team approach, and several specialists may be involved in your treatment. Your team might include a neurosurgeon or ENT surgeon, radiation oncologist, medical physicist, radiation therapist, or other medical personnel. The following steps are typical for Cyberknife treatment of brain tumors and other lesions in the head. The outpatient Cyberknife procedure consists of three main steps. Step 1, setup and imaging. Step 2, treatment planning. Step 3, treatment and follow-up. These steps generally are performed on an outpatient basis and are spread over several days. While it's important that you understand these steps, it's more important that you carefully follow the procedural guidelines established by your treatment center. The setup process begins with creating a soft mesh mask, custom fitted to your face. Your radiation therapist typically performs this step. The mask will be used to stabilize your head and neck during treatment. It is non-invasive and completely painless. While fitted with the face mask, you will undergo a CT scan. You may be given contrast dye intravenously to better visualize your tumor or lesion. The CT data will be used by the Cyberknife team to determine the exact size, shape, and location of your tumor or lesion. An MRI scan, PET scan, or angiogram may also be needed to fully visualize the lesion and nearby anatomy. You can usually return home after setup and imaging are completed. The treatment planning step is next performed by a medical physicist in conjunction with your doctors. You will not be present during this step. Your CT and MRI information will be downloaded into the Cyberknife System's treatment planning computer and used to develop a customized treatment plan. Your medical team will outline the target volume on the computer and input the optimal dose to the target, as well as identify nearby critical structures where radiation should be minimized. The Cyberknife computer then performs millions of calculations to generate the optimal radiation delivery plan for your lesion. Your treatment plan takes full advantage of the Cyberknife system's high maneuverability, allowing a more even delivery of radiation than can be delivered with frame-based systems. After the treatment plan is completed, you will return to your Cyberknife center for treatment. Your doctors may choose to deliver the treatment in one session or stage it over several days, typically no more than 5 days. Occasionally, more than 5 treatments may be required. Dress comfortably for your treatment. Remember, you'll be lying in the same position for up to 90 minutes. You may want to bring something to read or listen to for any waiting time. You will be escorted into the treatment room and fitted with your face mask. Your center may allow you to bring a music CD to listen to during treatment. The room will be cleared to protect the treatment team from X-ray exposure. However, you will be monitored through closed-circuit television and will be able to communicate with your treatment team at all times. Digital pictures are acquired by the Cyberknife imaging system to establish the target location. The computer-controlled robot will slowly move the radiation source or linear accelerator to multiple positions around you as you lie on the table. At each position, the robot will stop and fire a beam of radiation at your tumor or lesion. At various intervals during treatment, digital images of your head are captured by the image guidance system to verify the target location. If you move slightly, the change is detected by the imaging system, which automatically adjusts the robotic arm before firing the radiation beam. Each beam is thus accurately targeted to the lesion throughout the treatment. A typical treatment consists of 100 to 150 beams. You needn't do anything during the treatment except lie as still as possible. Treatment sessions usually last from 30 to 90 minutes. You can usually go home immediately upon completion of treatment and resume your normal routine. If your treatment is being staged, you will return for additional treatments on separate consecutive days or as determined by your doctor. The Cyberknife system represents an entirely new approach to stereotactic radiosurgery. It offers all of the advantages of traditional radiosurgery, but without the need for a metal frame. Best of all, the Cyberknife system provides new hope for many patients with inoperable or otherwise untreatable conditions.